I am 2 weeks postpartum, so this is like a quick update and body update. Okay, I'm not gonna show the back because I'm still in diaper, but so I lost like 25 pounds total. In like the first weeks I lost 30 pounds, but now I'm back up a little bit. But I still haven't done anything. I'm doing my pelvic floor therapy exercise at home. I'm gonna start walking slowly, like just 10 minutes at a time, starting this weekend. I've had my 2 weeks postpartum appointment with my midwife yesterday, and let's just say that I asked a lot of questions, and she wanted to know how we're doing after the whole hemorrhage and the whole birth. She said like my husband should see. He was there. It's like you should go see a counselor because it's definitely more traumatizing to you. And even though you don't think anything now, you think you're fine. Like when the next time that she's pregnant, all the anxiety is gonna come back because you don't want to relieve that. My midwife asked me about the 2 week, postpartum depression and the whole screening. They always do. And I told her like I have literally like no postpartum blues, and she's like, "Oh, I'm not surprised. I was expecting that." I'm like, "What do you mean?" She's like, "Oh, you're a tough cookie." So I was like, "Oh, okay, I guess that's good then." So she said you are still at risk for the first year for any postpartum depression or anxiety, but I thought I was weird that I was not normal, that I had no postpartum blues. But if my midwife expected it, then I guess everything is good. And I asked her about the whole placenta being 1/4 dead and everything. She said in like 1,300 births or whatever that she has never seen a placenta that has that much part that was completely no blood flow. There's a word for it, I don't remember, but completely dead and no blood flow. And also she did confirm that usually when the umbilical cord is on the side, this is when the babies are growth restricted. My baby was 9 pounds 2 ounces. She was not at all growth restricted, so even the odds were not in her favor, yet she exceeded them. So I'm still in shock about the whole placenta. Obviously, she did confirm that the whole placenta probably was part maybe dead like this to begin with, but also because of IVF. When you do PGTA testing and they take the cells of the placenta, that's why there's always placenta complication for IVF pregnancy. So I already knew that, but I was kind of I was just asking her opinion, and I asked about the hemorrhage, if there's anything that you can do to prevent it, and so there's absolutely nothing you can do. She says she was expecting either the hemorrhage or shoulder dystocia, whatever it's called. She was more so impressed that I didn't have shoulder dystocia. She really thought she was gonna have it, and she didn't, but I had postpartum hemorrhage. So I had one of the two that she really thought I would have because of like her experience and my age and whatever. And then I did ask about like the whole like DNC and stuff. She's like, "Oh no, you did have a DNC bedside," because when the OB came to like double check after her inside my uterus, he did have the curettage, and he went in with his hand, but he went in with the like, I guess it's like the spoon to clean the entire uterus. So I did have a DNC bedside. I wasn't sure, and that's why I have literally no bleeding. I'm not sure if it's gonna come back, but I literally have no bleeding, absolutely nothing at all. Regarding the pain down there, it comes and goes. Some days it's way worse than others. I found this pain relief spray. It has like 4% lidocaine, and I got it 2 days ago, and I think it actually works because sometimes the stitches really hurts. But she said you also push for 4 hours, and she was a 9 pounds baby, so it's gonna hurt for a while. So I don't know how long is a while, but I'm hoping I can go back on walks starting this weekend slowly. I haven't done anything. I'm just home with her. Regarding her and the breastfeeding, still no milk, nothing at all. I bought a scale for baby to weigh her before and after I breastfeed her, and there's absolutely no changes. I'm contacted a lactation consultant. I just want to at least talk to them, even though I already talked to my midwife and the doctor, and she did explain that PCOS will make because of the insulin resistance, will make you have low milk supply, which I had no idea. I mean, no one told me that PCOS girlies were at risk or had low milk supply because of our insulin resistance. So that is not fun, but it confirmed of why my milk is not here yet. Also, I do suspect that I might have like insufficient glandular breast tissue, whatever it's called, because I don't have any breast growing during the pregnancy, which I didn't, and I have breast implant. My chest was completely flat as a pancake. Like when you watch gymnastic women, you know, on TV, this is exactly how my chest was. And I know there's a word for it that my doctor said that I had, but that was 15 years ago. I don't remember. So I wouldn't be surprised if I have like insufficient glandular tissue, because I literally have no breast. So maybe that's also a reason why my milk supply is not coming in, or why it's very low. So I'm gonna confirm everything with a lactation consultant. And honestly, it's more stressful and taking so much time to like have to breastfeed her for 20-30 minutes and then bottle feed her, and I don't like the pumping. I really don't. I thought I will be exclusively breastfeeding my baby for at least 6 months to a year, and that's obviously not going well. So that's the only thing postpartum that I was not expecting to be that hard, but there's nothing I can do. I already drink 1.5 gallons. I eat a lot. I do everything. I'm taking all the supplement and brewer yeast and literally doing everything. So, you know, it's like I get to the point, it's like, I don't know how long I'm going to try for, you know, but if it's not working, it's just not working. And even though I was always against formula before, I've learned so much about why it's so bad when their blood sugar gets so low, because they can have brain injury. So fed is best. And at least, you know, I would say, like, I tried to breastfeed, but if she's not getting anything on the breast, it's like, what's the point? If she's getting a little bit, then I felt like, okay, it's better than nothing. But that's pretty much where we are 2 weeks postpartum.